Introduce our next set of collaboration demos. Joe!
Thank you very much. And I'll also mention that I'm part of the International Center for Advanced Internet Research at Northwestern University. All right, so we have a number of exciting demonstrations for you today. And we're going to begin with one that's a collaboration among Children's Mercy Hospital, Briefcase Health, and SightDeck. And what you're going to see coming in on the screen here is Morgan Weller from Mercy Hospital. SightDeck itself is presenting here a world first for the first time. They're presenting a distributed collaborative environment that allows you to casually create virtual collaborative environments at high-end Hollywood production-style quality with a lot of special features that are only available in high-end systems. And of course, this is running on high-end networks. So with that, I'm going to bring in our speaker remotely, and let's go for it.
Hello, my name is Morgan Waller, and I'm the Director of Telemedicine at Children's Mercy Hospital in Kansas City. Thank you for having me. Sorry that I'm not able to be there in person. I like this virtual travel. I'm here talking about the telemedicine program at Children's Mercy. We are the first hospital in the United States to have a SightDeck platform. We are using it in our progressive telemedicine program to help unite families that live in areas like this with our subspecialists in Kansas City. You may wonder, what is access and why is this a problem? What is telemedicine? And it really is nothing more than delivering care over distance. And if you live in areas like the Northwest, or the Northeast, or the West, and you are scattered with hospitals, and you have literally access to any specialist at the turn of any corner, it's a bit puzzling. But in the Midwest, we don't have geographical areas like this where there's just hospitals everywhere. We're stuck with a few in the middle, and that's it. So we're located roughly on the Kansas City. There's a handful of hospitals, but we cover this vast region where there are no subspecialists whatsoever, and the only way that families can access the care that they need is through telemedicine. We've taken a lead. We're one of the fastest growing telemedicine programs of any children's hospital in the nation. We partner with KU. I believe I saw Steve Fennell walk through earlier. He up in the audience and can talk to you a little bit about the program that KU has in collaboration with Children's Mercy Pediatrics as well. Can everyone hear me okay? Hey, all right, I see some heads nodding, very nice. All right, so telemedicine can be used in the home. It can be used in schools to replace taking kids out of the classroom to go to a doctor's appointment. We can bring the appointment to them. We can use telemedicine to collaborate with clinics, to bring experts to clinics, to share that learning osmotically while the patient is there being cared for by both providers. We can use it to take providers and meet them with other academic medical centers anywhere in the world. And these are just a few of the ways that we're using telemedicine at Children's Mercy. We have some of the world's greatest providers, researchers, experts. Dr. Kingsmore is a genomic medicine guru, highly sought after. He has a brain like few in the world. He recently did a presentation with a group from New Delhi He didn't have to travel and spend a 15-hour flight time plus numerous hours and opportunity cost law in order to collaborate.
Using software. Many of you are familiar with research genomes, and these are really quite different from what we did for this bid.
And I can let Dr. Kingsmore
can take a
take
month.
over the
That's okay.
presentation.
They need to be inexpensive. They need to be very accurate, and typically researchers are looking at all variations. In contrast, for a neonatal genome, we're trying to do this very fast.
So I can interact with Dr. Kingsmore.
And we're focusing
He's
in
an amazing guy, and I really appreciate him sharing his genomic insights with us today. The other, some other examples of how we're using telemedicine at Children's Mercy is we actually bring the providers from our main campus to some of our clinics in Wichita or some of the smaller regional access cities. So again, it saves the families the drive time to see their provider. The technology that SightDeck brings to us, beyond just being able to unite these families with their providers over distance, is we can increase the quality of the appointment through these educational tools that SightDeck provides that we don't even have the capability of presenting in a traditional in-person visit. So if we wanted to explain, for instance, if this little girl was being evaluated for scoliosis and we wanted to show the family exactly where on the skeleton her curvature was, we could do that in the appointment. And any ancillary device that we use, we can flip those pictures and make that available, and physicians can draw on those pictures and we can see the area that's affected. Are you guys enjoying your US Ignite time? Mm-hmm. Bye-bye, skeleton. Another really impressive way that we've found to use telemedicine is through remote collaboration and the ability to allow our surgeons who finish their fellowships to have their collaborative provider watch their surgeries remotely. Dr. Chris, who we will see here in a minute, can join me remotely, and we can collaborate in real time and assist through the audiovisual tools the provider that's actually performing the procedure. And he or she can talk to us and ask us questions.
So what's the network status?
We're going to go to Chris Greer, so Bill will go up next.
So if I wanted to argue with Chris, say no, he needs to be doing it over here, I can do that this way. Thank you, Dr. Chris.
Thank you.
So Children's Mercy wants to not only increase the access to providers in the region that we serve, but we also would like to increase our ability to share our providers' expertise with the entire nation as well as internationally. And tools like SightDeck allow us to do that. Dr. Chris?
Yes.
Is available for questions and answers and collaborative efforts. And he is going to talk a little bit to you about SightDeck Mobile, and then we're going to open it up to questions.
Okay, thank you, Morgan. All right, SightDeck is able to integrate with all mobile devices using their camera both as a background source for the SightDeck itself and for face-to-face you see me, I see you communication. What the remote audience sees is what you're seeing right now, the SightDeck output. So communication is precise and without confusion. And if you have any more questions, we will bring Morgan back on the floor.
Hello. So we'd love to hear some questions from you, either about telemedicine or SightDeck or the technologies that we're using. I believe someone asked a question, but I was unable to hear that. So,
Don't think the microphone's on. There we go. Morgan, I've got a question for you. Have you considered using the SightDeck to have sort of a collaborative effort amongst surgeons in a surgery so that you were showing before where they can kind of draw on things, but could you do it sort of where as you're standing on the screen, you can point, no, exactly right here, do this, that sort of stuff in an actual
yes,
surgery?
I'm not a surgeon, so, and neither is Dr. Chris. He's not even a doctor. So yes, the providers actually can use SightDeck technology, remote presence technology, to collaborate like that and to have a much more accurate visual field than what you were seeing was a sonogram in a surgical arena. But yes, this can be used exactly like that, and that's kind of what we were trying to portray.
And one more question. If it seems like this would be useful if I could say, call from some sort of medical emergency out in the real world, I'm at a concert, I'm at somewhere on my phone, and I could show you on a camera, say, hey, this person has some problem, can you please explain to me what to do, and I can actually have you there showing and pointing. Is that possible for telemedicine? Would that be useful?
Well, there's a couple of issues with that, and excuse me, I've got someone over here talking in my left ear. The answer to your question is the barriers to that are liability. Using telemedicine on a mobile device like that without having securely encrypted networks is a HIPAA violation.
Oh.
Yes, is it practical? Yes. Could it save someone's life? Absolutely. Do people use store and forward technology where they like snap a picture and email it to their provider? Yes, that happens all the time. So those are future applications, and what you're doing there at US Ignite and what US Ignite is doing by increasing internet access and internet quality will someday allow us to get there, but right now those limitations of security are probably the biggest barrier.
Thank you.
Sure, thank you. Anyone else? You got to have some good questions for us. Where's Paul? I was going to say, I can do a high five with Dr. Chris and we can hit it. Hi, Glenn.
Hey, glad you recognized me. It must work pretty well. So my question is, can you give us an example of a telemedicine that you've done with the SightDeck that is something that would otherwise have required the patient to travel to a larger medical center to be able to take care of? Something that really is an example of how that SightDeck has helped to provide more immediate care.
One of the ways that SightDeck is utilized, not so much in what you just asked about, but what we're piloting right now is a way to collaborate transition of care. So normally when our pediatric patients leave and have to go to an adult provider because of their age, say we've taken care of them for the last 10 years, now they're 18, and we don't want to push anybody out the door, but there does come a time when they have to transition to an adult provider. And that is really troublesome. It's troublesome for the family, it's troublesome for the patient. It is really a benefit to everyone if we can get the new provider together with the patient and the family and the existing provider from Mercy in the SightDeck forum, if you will. So collaborating like Chris and I, only it would be me, the Children's Mercy physician, Chris would be the new adult physician, and then the family would be here with us. And we could share that transfer of care.
That's great, and congratulations on the advanced telemedicine you're doing there at Children's Mercy Hospital.
Thank you very much. And I would like to throw in real quick that example that I just shared is something that we're working on in partnership with KU. All right. Well, if there's no other questions, you guys have a fantastic,
I have one. What happens,
Sure.
Obviously you've got to have gigabit connections in all of the various places you want to involve in one particular part of this. What happens when the power goes out, when the gigabit load, gets latency, bad latency problems, the kind of problems that we could come to expect in today's internet?
Well, certainly, we are not using SightDeck to cover all of those rural areas that I showed on the map of Kansas and Missouri. We are showing you the future of telemedicine, what is possible, how we're starting to use SightDeck technology as a tool in our toolkit. We have other technologies that we use to provide telemedicine services, InTouch and Polycom, as well as Time Warner. We kind of use a bag of different technologies to meet different needs. And obviously, as US Ignite promotes broadband access throughout the world, and as things develop, we all know you guys wouldn't be there where you are today if you didn't believe in the future. This will be available on your TV screen regardless of where you are. Right, Glenn?
You bet. Can we all give them a great hand?
Thank you guys.
Thank you.
You bet. Thanks for appearing. Bye-bye.